Hi, everyone. Welcome back to the podcast. Welcome, all new listeners, and welcome back to those who have heard my content in the past. If you want to know how social media has changed the world of physical therapy, you need to tune into this episode. Uh, Hi, everyone. Welcome back to the podcast. Welcome, all new listeners, and welcome back to those who have heard my content in the past. If you want to know how social media has changed the world of physical therapy, you need to tune into this episode. Before I go on to the podcast, what is new in life? What is happening? Always chaos. The new one I would share is my kids are challenging more and more, and you'll like this one. My son Zach, he said, I asked him, "Hey, will you please put on your shoes so we can get going?" And he said, "No." And I said, "Why, Zach?" He says, "Because that was a question." So I answered with a statement or with an answer, and I said, "Interesting. So you're learning that I included will or are you or do you in front of that." He said, "Yeah, that's a question, Dad." And so I explained to him what a statement was. Now I have to be actually very clear on my request. And to tell you, this is a 6-year-old telling me this, so that shocked me. So I'm hoping that gives you a little bit more direction wherever you are in your parenting style or you're working with your patients, your athletes. Be more direct, and I'm learning that with my son at the moment. That is a reality check 101. Life's good. I just came back from a personal development course and working on a few things as a leader, as a coach, as a husband, as a dad. So a lot of things behind the scenes, and I want to share some things today as it relates to the topic of social media and all the clinicians around the world, and how that kind of feeds into what we're doing as a profession, and ultimately, how does it help you as a clinician? And so that's what today's episode is going to be about. All right, so let's get on to this. What is happening with social media and how does it impact? Okay, so why am I doing this? So I think I think I started practicing in 2008, and I have learned a ton, both professionally and personally. And what has changed over the last 10 years is social media. And it really changed the game. And I opened my physical therapy practice, sports performance, in 2014. And at the time, Instagram didn't even have videos. It was just photos. And I think there was like, I don't know, 5 hashtags you can have, no location services. It was literally just a place to put pictures. And so I remember that. And YouTube was around, but not as big as it is today. And these are no longer like social media sites. These are like platforms. These are places where information is shared and all these other things. And how does that? It has changed the game. So for those of you who are just have entered the world of physical therapy, the profession, with social media as kind of a backbone to, what's how patients and athletes, see you as a clinician. Good for you. Yeah, and that's just how you've grown up into it. And I think you have to know where we've been to be able to know where we're going. And those who've kind of grew up with me on, you've been a clinician for many years, and social media has come out and has changed the way that you approach patients and athletes, and it should. And I'm going to share some feedback on things that I think that you need to include and be aware of so that way you're set up for success as you continue to navigate this. And the reason I'm saying that is because as I mentor more physical therapists, they're telling me their challenges, and these are the challenges that they're having. And one feedback came from a recent PT who registered for my upcoming Kickstarter course, the online mentorship, and it's an 8-week course. And I asked, what is one thing that you want me to cover? Like, what are the challenges that you want me to cover within this mentorship program? They said, I have practiced a long time, and I'm going from a certain setting into a more, they're going into more of a hybrid model where it's a little bit more insurance and a little bit more wellness services. And their biggest challenge is, changing from one setting to another, and not necessarily just a tactical skill of like how do I mobilize a little bit better, how do I do this, and it was more of like how do I speak to this consumer because it's a different consumer. I think that's a really the best way to put this. This is a different human, a different person coming into the office than it was 10 years ago. Same knee pain, different human and different brain coming into your world. And both parties, the clinician is now has a different framework and a different way they view that patient, that athlete, because both people are, or think about this, both people are watching Instagram, social media, Facebook, YouTube at night, doing the same thing from like 7, 8, 9 o'clock. They're both watching their phones on this person wants to get a service delivered to them, the patient and athlete. And this clinician sees what the patient and athlete is seeing, and they want to be able to deliver it. And so now where they both meet, now you have a clinician who has been viewing the same thing as this patient or athlete, and they're going to try and somehow meet and join forces to ensure that this person's successful. And why would it not work? And it's when expectations are not met on both parties. So I want to talk about how social media has really changed our profession. I think for the greater good. I really do. I truly believe that. I think that whether you fight it or not, you're going to find yourself in a position where, shoot, I have to be part of this. I have to understand it, because if you've been fighting this for so long, your schedule is probably empty with people that you don't enjoy treating, and you're probably stuck doing the same thing. And I don't think that any one of us along this podcast are for that, right? They're not an advocate of that. They want to change the planet. They want to do something bigger and better. And so, how do you set yourself up for success? So, I've got a couple notes here. For many of you, you understand that you have to come to terms with this. This patient or athlete is now more well informed than ever. And if you're treating people who aren't well informed, you can be in a whole different setting. If you're in a maybe a workers' comp setting, or you're in a place where maybe some people not necessarily like they're not the most motivated, right? I'm talking about the patient or the athlete who has been on social media. They've done it. We call them like analytics, right? They've done the research. They've been on YouTube. They've done Instagram. They've done Facebook. They're like, I want this. I've seen this. I tried this. I didn't want this. They were on Google for hours, and they now have this idea of what physical therapy is going to be and the treatment's going to be and what they like it to be, right? So here's that patient or athlete coming in with their bag of wants, right? They're like, I want this. I want to be running a triathlon tomorrow with no knee pain, and I want you to fix that in 42 minutes. Will you please do that for me? And then you have the PT on the back end who's like, oh, I know how to treat triathlons or triathletes. I've seen that on Instagram. I don't really regularly see them, but I know that I need to work on their running form, their cadence. I need to work on their shoes, and I know that I need to work on their strength training. And so here's the PT. Here's my bag of wants for your bag of wants. And somehow they don't mesh, right? Whether that's the expectations or the timelines or all those other things. And you have to be able to navigate that. And some clinicians get frustrated at this. They're like, oh, these patients and athletes are coming in, they're expecting all these other things, and then sometimes the patient or athlete's like, oh my gosh, I can't believe that PT has an unrealistic expectation. They're thinking it's going to take me 6 weeks or 8 weeks, but I saw it on Instagram and I saw this person get better in 2 weeks, right? So you have all of these things, and so that clinician and the patient are now both more well informed. More importantly, the patient or the athlete is more well informed, and that changes the game with how you talk to them. And most PTs aren't aware of this. But the reality is the patient or athlete no longer cares if you're a doctor of physical therapy, a master's of physical therapy, a bachelor's of physical therapy, a certificate in physical therapy. They really don't care at this moment. But the clinician really does, right? Some of us have gone to school for 4 years. Some have gone for 6. Some have gone for 8. Some have gone for 12 years. And you want to justify that with how you approach this patient or athlete. I'm a so-and-so. I'm a doctor of physical therapy. I'm a master of physical therapy. I have this expertise. But the patient or athlete doesn't care. They're more well informed. They're like, I don't care what you look like or do. I want the thing that was on social media. And sometimes that creates like a battle between the two people. And I've seen it and I've heard it. Believe me, I'm telling you stories that I get from clinicians on a regular basis. This patient doesn't respect me. They thought I was, a high school student. I've had that happen where a patient or athlete thought they were straight out of high school. That's a real deal. So I think that's a real deal. So I think that the patient or athlete is more well informed. they're seeking services regularly. So think about this. The way your patient athlete used to see a PT is that they would go to their primary care, get the x-ray, get the MRI, get a prescription for physical therapy that takes 2 or 3 weeks. They get into an office and they're told, hey, you have to do these 3 sets of 10 for these shoulder exercises and get this TheraBand and take it home with you. And you're going to magically get better in 28 visits over 6 weeks. And yeah, usually that's what you have to do. And that used to be the way, and not anymore. People with PPOs, HMOs, wellness services, I mean, they'll go direct. I mean, it's a whole different gamut. So the way it used to work won't work anymore because some people are saying, I don't want to deal with that, or I've already dealt with that. I want to try something different. And here's a PT with the green TheraBand saying, well, like that's just how it's always been. I don't understand why you're trying to change the world. So it changes how people approach what they're looking for. So you as a clinician are saying, are you looking for physical therapy or are you looking for a solution? Two different things. Physical therapy can mean something so different to this human being. The patient or athlete can have this misconception of physical therapy. And the clinician's like, I'm a physical therapist. And that actually might work against you. So now you have clinicians who are more aware that sometimes patient or athletes have a negative view of what physical therapy is because of what other clinics or other people have done to them. And so the real question is, can you communicate with them that you are a solution for them, not necessarily just physical therapy? Physical therapy puts you in a domain, right? You've heard me on a previous podcast. Physical therapy tries to showcase that we're movement experts, that we are going to help you move better and solve your knee pain. But social media has changed that because there are so many specialists, so many clinicians, so many people out on the world who can take individual courses, some type of movement course offered by, I don't know, a movement company that is not necessarily rehab focused, but just a general movement analysis company. Take a taping course that has nothing to do with clinicians, and then take a cupping course in by some online school. Pair that together, you might have people who are trying to showcase that they are a rehab expert, and the patient athlete doesn't know any better. This is the truth. If you're not seeing this, you need to. It's a real deal. The patient athlete doesn't care. They just want a solution. And so when you advertise, you're like, I'm a physical therapist. I'm going to solve all your problems and I can help you move better. They're like, yeah, but I saw on social media, that's not what I want. And so you can't put yourself in this category of the way it used to be or the way you were trained, because the modern day patient or athlete is looking for something totally different. They're not looking for just exercise. They're looking for solutions, which may include exercise. Now you might say, Chris, that's semantics. No, 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 it's the truth. And I think if you're always trying to sell exercise and movement, you're going to pigeonhole yourself into failure. And I think you need to understand that patient or athlete is well informed. They're getting communication more than you. For them to come see you is going to take a long time. They're getting more information on their screen, and the way they approach getting a solution is going to be totally different. And why is this so important? Because you now truly, more than ever, have to blend what they need and what they want. Before, it used to be like, well, they didn't have any access. They were like, well, I was told to come to physical therapy. What do I do? And you're like, you were the main chef. You were the dictator of their rehab. And now they're like, nah, I've already tried the band exercise. I've already tried the glute sets. I've already tried the squats. I've already tried looking at a mirror and, trying these good movement postures and all this other stuff. I've been trying that for 4 weeks, up to 8 weeks, maybe 12 weeks. What are you going to give me that's so different where you're like, oh, shoot, you took away all my ammo. What do I do? And that's where I find people stuck. And you have to meet them where halfway between their wants and their needs. So how do you do that? What are some strategies that people are doing? I think you have to change your approach. It's no longer about their like knee pain. That's the truth. And anytime that you're working with somebody and they say, hey, I have knee pain when I'm running more than 3 miles. Okay, great. Um, you now have to dig into, before you look into mechanics of like, let me see, you have knee valgus, let me see what your ankle looks like, let me see all these other things. You have to take a bigger step back and ask, great, what's the long-term goal with this? Because I need to be able to know what your next few weeks look like. How often do you train? What are the shoes? When did you start training? Look at all things backwards and forwards. Physical therapists always want to look backwards, but you always have to look forwards too. So what I mean by that is, when's the event? 8 weeks. 8 weeks. Okay, now let's work backwards from the event, not from the time of injury backwards. So 8 weeks, you now have to forecast. Now you have to give the well-informed patient athlete an actual roadmap week by week, because now they're like, oh yeah, I heard, I've seen another person on Instagram or Facebook that can do this in 4 weeks. What's so different about you? And you're like, well, this prescription says 8 weeks, so I don't know how we're going to do this. But they don't care about that. They want to achieve a goal by a certain marker. So now you have to work backwards. Now you have to be able to learn how to like program and forecast and actually plan out what you think you're going to do, not just go week by week. So I think it forces the clinician to be more prepared. I think that puts accountability on both parties, whereas before it used to be, oh, it's just the patient or the athlete's accountability. Like you have to go home and do this exercise. But the patient or athlete's like, no. I've been doing those things. I need you to help me figure this out moving forward. And what are the 2 to 3 things that I need to do to avoid? And you're like, well, I never really thought about that. You're going to be hit in the face more often in the next 5 to 10 years than you've ever been, because people are coming in so much more informed that you have to actually be prepared, not just show up, because that patient athlete now has a choice. They have a choice to see you. Whereas before it was like, this is what the doctor said, this is where you go. And now they're like, let me look at my plan. I'm not going to that. I'm gonna go to this 3 places, and this one looks a little bit more reputable, and this clinician has specialized in shoulders, and they have blah, blah, blah. So now it's no longer about your degree. It's no longer about how many years you studied. It's not even how many years you've been practicing. It's what you can do for them. And ready for this? Convey that in a simple, easy to understand message. Within my team, I call it speaking English or speaking German or speaking Spanish or whatever it is. Imagine I was trying to teach you German and you never heard it before in your life. I'm going to simplify it. I'm like, say this word equals this. And it's going to take me it's going to take this long to be able to, form a sentence. When you speak a different language, you have to be so much more simplified. You have to be so concise. And sometimes we speak PT jargon to the patient athlete, and they're just literally like behind the scenes, like Charlie Brown. They're like, wah, 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 wah. They have no idea what you're talking about. And so I say, speak a different language to them, to my team, anybody I mentor. So speak German to them, meaning this is your program. You're going to do it for 2 weeks every day. And once you figure out those 2 weeks, we're going to reassess. But the next 4 to 6 look like this. At week 4, you will run. At week 6, you will return to sport. If there's any hiccups in between, it's because you didn't follow the plan. Here are the 2 to 3 things you need to be looking out for in your daily life to avoid. You have 4 to 6 weeks mapped out. You have things to do at home and things to avoid. What questions do you have? And that's so simple, right? Like so much that your mom, grandma, your aunt, your uncle can understand that. It needs to be like that. So here's PT jargon. Here's what doesn't work. Ready? Yes, Mr. Jones. So the reason you're having knee pain is your vastus lateralis on the outside of your leg, which attaches in near like where your IT band is. You see that stringy thing? Yeah, great. Anytime you go into knee valgus, yeah, when your knee goes in, your patella now has shear stress on the lateral portion. And it's because you don't have ankle dorsiflexion. So every time that you go into knee or knee flexion, loaded or unloaded, you happen to have more stress on the outside. And that's why you're having that lateral knee pain. Does that make sense to you, Mr. Jones? And they're like, I don't understand a single word you said. Oh, I'm so sorry, Mr. Jones. Every time you bend your knee going down, you have bad mechanics and it's placing more and more stress on the outside. We need to stop doing that. See the difference there? Very, very clear, very distinct. Think of my son, Zach, right? Asking the question, and you need a very clear statement that you just need the answer for. And that's all people are coming for. And people have done so much research behind the scenes. They don't need any more of the like big background stuff. They just literally need the answer. And so when you're talking to a well-informed athlete or patient, you should have to be a little bit more direct and speak English to them. Or maybe in some cases, speak Spanish to them, meaning simplify it so that way they can understand it. Get away from the PT jargon. How else does this change your approach? I said you have to, it's no longer about their pain. You have to identify their wants and the need. I said it requires that you improve your communication skills and not just your like technical skills. It's not about that. I think there's one other one that I'm a big fan of, I'm a big proponent of, and it's something that my grandma, who raised me, has always focused on, and it's where I take pride in when I am working with my team, the PTs I mentor, anybody that I'm engaging with, and that's human first and patient second. And what I mean by that is that sometimes we think of them as a number, we think of them as a unit of those, oh, this is a 4-unit patient, this is a knee patient, this is a blah, blah. And there's a human behind that. And most clinicians, as you get into this wheel of, treating, you forget the small details. And you need to understand that these people are coming in more informed. You got to change the way you approach them, balance the wants and the needs, improve your communication skills, be more direct, speak Spanish to them, or as if you're introducing a brand new language to them. And lastly, treat them as a person, as a human, because you want to make sure that they're successful. But you're so busy getting into documentation and everything else, they now have a choice. And if they're focused on the service, you're focused on getting their knee pain. They're focused on what was this experience like? What was this service all around from the front desk to you and everything else? You know what they care about? They care about, will I come back? And they have a choice. And so to you, you're like, well, it's a no-show, it's a discharge. How do you feel good about that? Because I know your parents wouldn't advocate for that. You're supposed to be doing great at your job. You're supposed to be hurt when somebody doesn't show you because you're like, wait, I thought we were on the same page. I thought I was doing good. That means you didn't do your good job. So when people discharge you, then self-discharge, they're just not happy with the service or the experience. You cannot tell me you take pride in that. Yeah, you have an open hour, but I didn't know you went to PT school to have an open hour. You did it to impact people's lives, and you're like, oh yeah, but that's only a select people's lives. No, who cares? Just treat everybody in front of you the same. Push them, motivate them. Tell them how you can, improve their life. They're coming to you for a reason. And especially if they're a modern day patient athlete, does all the work on the back end of social media, you have to change the way you approach them. And if you don't, guess what? You have an empty schedule and you're like, yay, you're like, that's an amazing day for me. Yeah, but I'm telling you right now, you're gonna have a hard time retaining being like employed. You're gonna have a hard time being successful. And more than anything else, it impacts your view of what you do. You're like, maybe I'm a bad therapist. Maybe I don't like this profession. No, no, no. There's still a chance. It's just the way you refine and change what you're doing. You maybe have been going to Con Ed courses, CEU courses to improve your like fundamental treatment skills. But what about your awareness of everything else that goes into it? You have to get people in the door first, and you have to actually like have a really good quality service that leads to better outcomes with the treatment skill. But if that person now has a choice to come back, why would they come back when you can't even speak their language? You didn't balance what they need or want, and you give them a roadmap. You didn't tell them what to expect, and you just focused on your treatment skills to do all the work. Treatment skills don't have a language. Yeah, they give them the right outcome, but if they're like, you're boring, like nothing really like excited me about this, they have an expectation of what rehab or physical therapy is going to be like, and you have to figure out what that is. That's a whole nother job. Most people have been like, wow, I don't care. I'm a physical therapist. I'm going to put my polo on and I'm going to wait till they come in to see me. Not anymore. They're going to trial you. They're going to test you out. I promise you that. People are just going to test you out. And if they're only coming for, if the physician or the prescription has 12 visits, it might be only be doing 6. So they're like, waste of time. Not going to do this. It's just a modern day athlete. Sometimes you'll blame it on them, but actually sometimes it's on you. And I think that's why I need you as a clinician aware of these things so that you're successful. And if you're not, you're going to think that this profession wasn't for you. And I don't think that's the case. I think you're a motivated, phenomenal clinician. I just think that you're seeing it differently, not from the patient or athlete side, the modern day patient or athlete. So social media has improved your clinical skills, but it's also improved the patient or athlete's view of what it should be or what it could be, more importantly. So wherever you are on this planet, just remind yourself of that. And sometimes it's not just our clinical skills, but it's also the experience that we provide to them that keeps them coming back. And if you want to have a full caseload of people that you love, I bet you if you implement some of these, you'll have a day's worth, a week's worth, a month's worth of great humans coming to see you. Why? Because you treat them just equally, and they will enjoy your company. And some of these things are very fundamental. Some of them are very important to the way that you practice. Some of you have already been doing this, so like, okay, those are just checkbox. I'm doing the right thing. For some of you, you're like, oh, I got to revamp. I got to restructure the way I do these things. So, I think the main premise for me, like for making this podcast, was because the more I see it, these are the trends that I'm seeing right now. The clinicians, they're blaming themselves that their outcomes aren't good. Well, it's also because you're just not seeing the bigger scale of people expectations, like why they come in to see you. And for me, this is if for those of you who are signed up for my online mentorship program, this is where I'm going to cover, I think, on the last 2 or 3 modules, and working on some of these things on working on the injury preventions, no problem. Sports rehab, no problem. Strength conditioning, no problem. But now tying that all together, that's the art what makes a really good sports therapist. And especially when you're in the pro world or when you're in elite athletes or collegiate athletes, those people have a choice. If you're a clinician in any of those realms and you have an empty schedule, that's kind of embarrassing. It's because you don't even have barrier to entry. Now it's just you can't deliver on the expectations of the service. And so ultimately what you're trying to do is refine that, and you're probably becoming obsessive. When I don't have a full schedule, it frustrates me because I'm like, what am I doing wrong? And so constantly looking at that, and sometimes people don't look from that angle of, am I meeting their expectations? Well, what are the expectations? Well, I thought it was just physician. No. Social media has now delivered a certain level of expectation. So I hope that helps. A little eye opener for some people, and for those joining the mentorship program, you're going to get more of that in detail on setting yourself up for success. For those of you who are interested, come on, join on board. It's whenever you listen to this, 2023. It starts January 11th, 2023. And it's 8 weeks, joining me for 2 hours, 8 weeks every Wednesday, 5 to 7 p.m. Pacific Standard Time. And it's really just going through how to set yourself as a sports physical therapist in working with today's patients or athletes, and making sure that you are within all domains improving every aspect of treating athletes, not just the 4 weeks to 16-week specialty that we are as orthopedic PTs, but also the on-field coverage, acute injuries, subacute injuries, how do you treat them differently, the strength conditioning, true strength conditioning, not just a glorified home exercise program, but true strength conditioning with focus on like preseason, off season, postseason, in season. How does that change? What are your mesocycles and microcycles? And then on the injury prevention, how do you do that? So trying to put that all together. But if you don't understand what the patient athlete's expectations is, you're in deep trouble, and none of that matters. So I hope that puts it into a greater perspective on what it is that you need to do to refine your craft. And that's what it comes down to. You're doing great. Now it's just, what else can I be doing? What dials can I turn? What else can I adapt? So that was one missing piece that I'm seeing right now with the PTs that I mentor. So hope that helps. Hope you guys are doing amazing on this planet and staying healthy and active. I will see you guys on the next episode. Take care. See ya.